Okay, this is chapter 3, ethical principles and values. So what we're going to learn in here are to be able to identify the normative ethical principles and the principles that are used in dental and dental hygiene because many of them crisscross. We're going to describe the difference between a choice and what's an ethical dilemma. We're going to explain the roles of principles in decision-making process and compare the values and ethical concepts that support the principles of ethics. Okay, so these are the normative principles: non-maleficence, beneficence, autonomy, and justice. So those are the shared principles that we are going to talk about. And those, let's go back up to where we are. All of those could be true or right or good for all people in all times and all places. Trying to do no harm, doing good for people and removing harm, giving a person their autonomy. And so all of those, and justice for everyone, could be good for all people in all times and all places. That's what a principle is. So it's derived from a common morality and traditions of healthcare. So this provides a comprehensive norms in biomedical ethical framework analysis. And I say biomedical, you're going to hear that word a lot in ethics, and we are in a biomedical field, just to let you know. So it's a framework. So let's take the principle of non-maleficence. First, you're going to hear Latin, a couple Latin words. This first one is primum non nocere. The C in the third word is pronounced like a K. So it's primum non nocere. Latin for meaning do no harm. Okay, first, do no harm. Primum, first, non, no, nocere, harm. So it is the founding principle of all health professions is non-maleficence. And also, which would include primum non nocere. First, do no harm. So it is our first and founding principle to not do any harm. And I'm pretty sure that's exactly a quote from a quiz question. Anytime it asks you what the founding principle of all health professions, or just the founding principle is of any profession, you would say it's non-maleficence. So that is our very first obligation and the very first thing that we have to weigh the very most. Everything else can follow behind. So it also evolved through the years, and they included in that do no harm is preventing and removing harm and doing good. So they added those things into it. So like a hygienist removes harm when we treat patients with active perio disease. So we are practicing non-maleficence, and we are practicing beneficence by removing harm. So the American Dental Association's Code of Professional Ethics states that professionals have a duty to protect the patient from harm. All right, and that's what we have as well. Example, even maintaining your level of knowledge, which means after you graduate that you constantly are learning by taking continuing education courses and studying, that your whole education isn't going to stop the minute that you get your license, that you're going to continue to evolve as a professional. So that would be preventing harm. So patients place themselves in the care of another person, and at a very minimum, they should expect that no harm is going to come of it. Okay, so they come in, they trust us completely. They come in to get their teeth cleaned. They don't even think about it. They don't expect there to be harm. And they grant us the privilege of access to a portion of their body for the explicit purpose of taking care of their oral health, and a privilege that is founded in trust. So trust is huge. fundamental to that trust is that the healthcare provider will do no harm to the patient. So we need trust is huge if we want to keep a patient base. So we have, as a hygienist, an obligation to stay up to date with the changing standards of care and prevention of harm. Example could also be SRP and patient education to those who have active perio disease. We are trying to take care of the disease and also educate them on it. So a hygienist who's not familiar with certain procedures like sealants or anesthesia should defer performing that service until achieving competency in order to keep this trust and prevent harm. So let's talk about the hygienist who goes into a practice who they send everyone straight to a perio, and the hygienist does very little SRP. They mainly clean the teeth and take care of the oral health, and they don't really deal with much more than that. And the dentist says, I want you doing that, and I want the assistant doing sealants. So in other words, maybe for a year or 2 years or whatever, you haven't given a sealant. You haven't given anesthesia. So is it right that all of a sudden they change their policy and say, no, we're going to start doing SRPs in our office, and you have one tomorrow, you have 3 that are going to need anesthesia? Well, or sealants. Is it really ethical for you to do that, even though you have a license in it? And it's really not. You have to prevent harm, and what you'd have to do, since you do have a license, either take a refresher course, or you could have a fellow hygienist come in the office and have the dentist, watch you give the injections a little to each other and get your competency level back up. So we don't just use our patients as guinea pigs if we haven't done something. Even if someone else thinks you can, if you know that you haven't done something for a while, then don't do it. So a dentist's primary obligation, and a hygienist also, is keeping your knowledge and skills current, knowing your own limitations, admitting that you don't know how. Don't just say I do because you're afraid of getting fired and then go in and not know with a patient and a needle. Okay, so there's an easier way to be able to get your skills back up, and then you can do it. And so you need to know your limitations and when you need to apply that, and when to refer patients when it's appropriate. One of the biggest things that they have as far as lawsuits or being in trouble with the ethical board is when dentists will not refer. They want to keep the money there and keep that patient there. And so a patient could have a 10 millimeter pocket, and clearly at 10 millimeters, they should be at a periodontist. So, but the dentist doesn't want to lose that patient, so he has the hygienist be doing 10 millimeter pockets, and that really should not be done. So you need to know when to refer patients when it's appropriate. The application, how do we apply non-maleficence? Okay, so they're saying it's unrealistic to interpret do no harm as avoidance of all pain, because we all know that we have to give a little pain sometimes, like as in anesthesia. We're going to give a little pain, a little prick with the needle, and the first few seconds of that anesthesia going in, which can burn. And we have to do that in order for the greater good of having an hour's worth of hopefully pain-free. So we can't always avoid harm. We're going to do harm to create less harm in the long run. So that's why they call this the principle of double effect. It's some degree of harm may be beneficial in the long run, and it requires health care provider to consider the risks and benefits whenever treatment is provided. And that's one of the major tasks of ethical decision making. So we have to decide, okay, non-maleficence, we have obligation to do no harm, but now we're getting ready to stick this patient with a needle, and so we are going to cause harm. And so we are weighing the benefits and the risks. Is it better to let them suffer through an hour of excruciating scraping on really deep pockets? Or is it better for the patient to give them a short-term harm for a longer term of hopefully pain-free? So it's obvious which one that we should choose, and we're always making that decision. But the double effect means that you're weighing the risks and benefits of something all the time. So there's a hierarchy to non-maleficence, and it's like 1, 2, 3, 4. Number 1 being the most important always. If you're trying to make a decision, one ought not to inflict pain. That takes precedence over everything. So the second thing that you need to think of is one ought to prevent harm, which is really the hygienist domain, is what they call that, preventing harm. We are a preventative entity. We are going to try to prevent different diseases and to prevent harm by education and cleaning of the teeth and SRPs, actual all-around oral health. So one also ought to remove harm, and that would take precedence over the last one, which would be one ought to do good or promote good. And so it sounds like that doing good should kind of be the first one, but in fact it's not. We all should try to implement all 4 of those parts, okay? But every once in a while there can be conflicts, and when there's conflicts involved, then you have to go to this hierarchy and kind of think downwards of what takes precedence over what in your decision making. You could, let's say that you were driving and you saw somebody in a wreck off the highway. And when you do that, if you're going to want to be like a good Samaritan and promote good and stop and help. And so you stop the car and you go to help, and you see someone that's, half in and half out of a car. And so you pull them out, and maybe they're unconscious, and you pull them out and you're moving them all over the place. And in trying to do that, their neck snaps. Okay, so you were trying to promote good, but you inflicted harm. You left that person in more harm than when you first saw them. Okay, so that's why not inflicting harm takes precedence over everything. We might have good intentions, but we have to think, if I move that person, if the car catches on fire, then it's better to take the chance of snapping the neck to try to get that person out. If the car is not on fire, it's a better thing to call an ambulance and have them come out, and you not move that person, not knowing what injuries that they already have, just because you're trying to do a good thing. The good thing that you did was possibly call 911, and stop. So we need to first not inflict harm, and then somehow prevent the harm, try to remove it, and then promote doing good. So once again, we'd like all 4 to be in every decision that we make. Sometimes it's not possible. This is the principle of beneficence. Beneficence means doing good. So requires, in order to be working with the principle of beneficence, it requires that the existing harm be removed. Like if we're going to do a good thing for a patient, it doesn't require just being nice to them and friendly, and they're afraid that it's going to hurt, so you just leave all the calculus down there, okay, because you're wanting to be good and nice to them. We need to remove what's harmful. We need to remove the existing harm, and by doing that, we are focusing on doing good. So it's often linked with non-maleficence, because often when you're preventing harm, you're doing good. So non-maleficence and beneficence are often hooked very close together. Beneficence is found in all healthcare codes, no matter if you're a nurse, a hygienist, a doctor, a dentist. It's in all healthcare codes, and it has been as far back as Hippocrates. So these aren't things that people have just newly thought up. These have been around for centuries. Doing good requires taking all appropriate actions to restore patients to good health. A dentist and hygienist have unique qualifications that make it possible to benefit the patient by removing existing harm and by assisting in the prevention of future harms. So we have the ability to do that. A prevention of harm clearly is the domain of dental hygienists. Okay, prevention completely, and prevention of harm definitely. So let's say examples, using standard and universal precautions is prevention of harm. Doing an SRP to preserve the teeth and perio tissues is the prevention of harm. Giving oral home or health care instruction, oral home care instruction is trying to prevent harm. So removing harm is, remember, hooked with beneficence. Our hygienist's primary focus, of course, is to prevent oral disease and always maintain the oral health of our patients. So an example, like we said, is the treatment of active perio disease. We want to remove that. Now here's your second Latin name that you'll need to know, and we'll go into more a little bit later. It's called prima facie. So F-A-C-I-E is pronounced like fascia, like F-A-S-H-A. And it means at first glance. And we'll go more into that in a minute. So how do we apply beneficence? We promote good, and promoting good is a daily purpose and goal. I would know that for hygienists. It's prevention and removing harm, and it's promoting good is a daily purpose and goal. Failure to increase good of others is morally wrong for us. So biomedical research, public health policies and programs, and preventive medicine are the formalized aspects of this. So you can go, you don't just, have to be in a private practice. You could go into all of these different avenues and still be promoting good as a daily purpose and goal. So the community-based activities attempt to meet the needs, of course, of the public. So beneficence and non-maleficence is actually in the Hippocratic Oath that a doctor takes. And the Hippocratic Oath is from Hippocrates. So it's been going that far. So beneficence, problems when the good holds different definitions. So what's good to one of us isn't necessarily good to someone else. So we take a consequentialistic approach, which means we try to weigh the consequences for the best possible outcome. If I do this for you, if I do an SRP for you, we're hoping to get a better possible outcome. I have had this happen also. It's an example in the book, and it was with older than me, older folk that maybe are in their 80s. They don't know how much longer they're going to live. Maybe they're 70s. They're thinking about kind of the end of their life. They don't have great home care insurance. They didn't take care of their teeth as well when they were younger. The generation that was right before me, most of them didn't know what a hygienist was. You were kind of wealthy if you went to someone that had a hygienist. Most people didn't even know what that was. So I had a gentleman come in, and he wanted the rest of his teeth. He had about 8 teeth left. And of these 8 teeth, they were good. They had a lot of recession, etc., but they were good teeth. And so he's like, I can't keep affording this. I would rather let's talk to the doctor. I want him to remove all of my other teeth, and because they keep getting decay one by one. And instead of just restoring those teeth, I'd want him to take them all out and maybe possibly get a denture. And then I can just pay for the denture and be done with it. Well, we dentists and dental hygienists have a responsibility and take an oath to preserve enamel and preserve good teeth. We never want to do anything for the destruction of the tooth. And so even though it was his autonomy to want this, it was definitely could cause him harm because you're destroying good teeth. And so his autonomy and respecting him as a person and possibly having harm and not doing the best for him, which is beneficence, was in a conflict. So like, what do you do? What do you say? So that might be the good to him. Being good to him would be just take them all out. Well, it's not to the industry and not what we promote. So the teaching of oral hygiene self-care to maintain health and function is also an example of promotion of doing good to many. So principle of autonomy, self-determination and the ability to be self-governing and self-directing. So that is all. If you see anything on a test and it talks about self-respect of a person, respecting one's opinion, being self-governed and self-directing means that a patient can be self-directing in themselves. And he, like that guy, he's saying, I'm going to be self-directing and self-governing, and I needed to respect his wish of having all the rest of his teeth taken out. But so I was permitting him to make decision about his own health. And the dilemma is permitting them to make his decision about his own health is a problem for me as a professional and for the dentist. So all we can do is explain all the parameters of the services that can be performed, as well as the consequences of performing those, of removing all of his teeth or not performing those services. And when we can explain to them, when we respect them by telling them about what we want to do, why we want to do it, the consequences of doing it, what may happen, and as well as what may happen if we don't do those services. And then they can make a healthy decision. So the application of autonomy. First of all, autonomy was founded in the science of deontology. Remember that every word that ends in ology means the study of, and deon is duty, so it's founded in the study of duty. They call it the science of duty, and it's based on respect for persons no matter what the consequences are. So the problem with this is there's good sides and there's bad sides to all of these different ways of thinking, because you want to say, yes, we need to respect that person no matter what the consequences are. But for example, if it would be worse for him to have his teeth extracted, not all people that have dentures, there's issues with dentures also. And, some are really happy they got him. Some are forever sad that they did. So is that really the best thing? So we can always we also as healthcare providers can express our autonomy and say, I appreciate why you want these teeth. I can understand your reasoning. I respect that. But we are taught and take an oath not to promote harm. And so I'm going to express my autonomy as a dentist, and I'm going to say, if you want that done, you need to find another dentist to do that, because I can't do it, okay, under my oath. So we also have a right to our autonomy. So another example, for people who just totally believe in the science of duty, they want to say, it's a rule, no matter what happens, if we need to base respect for another person, okay, and people that believe in duties believe in rules. So if it's a rule to lie, okay, lying is wrong. So if you're going to say lying is wrong, no matter what are the consequences are, you've got to think, if lying is wrong now, then lying is always wrong, even if that results in harm to others, even if it, no matter what the consequences. So think back to studying in school or watching shows about wartime and the Nazis. So what that would be equivalent to is if someone in Germany was hiding a Jewish family, and they were hiding them in the basement, and they totally believed in the science of duty, no matter what the consequences were. Then when the soldiers came to knock at their door and they said, "Are you hiding anybody here?" They would have to say, "Well, yes, I am," because they believed that lying was wrong no matter what. So there was no gray area. So that's not where it's all cracked up to be, but autonomy, it's founded in deontology, but then we have to put our spin on it and kind of put it into a category that works better than just a flat belief in only a duty. So obviously a dilemma occurs when a patient and professional don't agree what's best, and the healthcare provider has the duty to provide the patients with an unbiased information, enabling that patient to make the best decision. So, and then we get to make our own decision. So as long as the patient selects from his treatment options that are the standard of care, then we can ethically act on the patient's choice. But when it's not standard of care, like removing all their teeth or something for just a reason that they don't want to come back, that is not ethical. Even though you might understand it, I'm sure there would be somebody that would oblige him, but your dentist or you may not, because it's ethically not right. So we do have he has the right of refusal, a patient, and we have the right of refusal and not providing a service if it's in conflict with the standards of patient care. So it is ethical to refuse a patient's request to extract healthy teeth, even though that would conflict with the patient's autonomy. So we have to take non-maleficence as being the very top one principle that we have to, and most important principle that we have to just make decisions. So now we're going to go to the principle of justice. These principles, and these are the normative principles that we're talking about: non-maleficence, beneficence, autonomy, and justice. So justice has to do with what is providing individuals or groups with what is owed, due, or deserved. You see those three words, you know to pick justice. Okay, what is owed to them, due, or deserved? So it is a fundamental to the principle of equality. Okay, is the foundation of justice. So that's what we all go for, but is to treat all people with similar needs in a similar or identical manner. Even though we always will strive to do that, that really isn't the way it is in real life, because it sadly still is that those that have the means to pay for treatments usually can get the treatments, and those that don't can't. So that's not exactly equal, but it is something that we're constantly striving for. In dentistry, we refer to distributive justice. You have justice with what's owed, due, or deserved, what makes equal, that if one person needs, two people need SRP, and one has money and the other one doesn't, they should really both be able to have this treatment. Not usually the way that it works, but distributive justice has to do with large social systems. It has to do with how it's allocations. It's how our monies and resources distributed to the mass of people. Do the people in the bigger cities get more allocation or money from the state than the people in rural areas. Okay, if the state gets this big, has X amount of dollars to spend on fluoride in the system, dental, not charities, but dental, well, it would be like a charity, like Team Smile and MoMom. They have more money to put on those places. Shouldn't it be that everyone should be able to have the same money from the state, you know, per capita, per person? And yes, it is. So just allocations and resources for the good of society, and also globally. You know, the United Nations has a certain amount of resources, and where do they give it? A lot of the world needs a lot of resources. How do they know how much to give what country? And does every country that needs it, there are so many more that need allocations for health care and dental care, do they all get the equal amount? No. But it's something that we strive for. Distributive justice for global or community or state is most often discussed in terms of public policy issues. Now I'll let you read those little things yourself. Application of justice. So it's very difficult, healthcare services, and mainly because there is no legal mandate or law in the United States for medical and dental care to all equally. There, we don't have socialism medicine. There's no equalness about that. So that's what makes distributing everything a little more difficult as well. Access to care is granted by the ability to pay, and so it is not distributed equally. So many of the hygienists and dentists provide charitable services on a regular basis in private practice or community-based dental programs, but of course it doesn't come close to meeting all the needs that are out there. Some examples are what I just talked about: Team Smile, MoMom, and school screenings. So values and concept. We're going to talk about values. They are paternalism, veracity, informed consent, capacity, and confidentiality. So paternalism, I have a little thing. Paternalism has been around since Hippocrates also. And until the last like 30, well, maybe 40 years or so, it was the norm. And then it began being a little bit more of a patient's ability to make a decision. And after the internet was in almost every house, it began to be flip to not being paternalistic anymore. So paternalism is when you would go to a doctor for all your needs and you trust whatever they say. Because you don't know, you know that they know more than you do. Okay, so this was it's closely related to the principles of non-maleficence and beneficence. Do no harm. I want to create good. I'm going to be the parent, and the patient is going to be like a child. And as the professional, I'm going to make the recommendations, and the patient should just go along with it. And as people began to get on the net, people began to take more of a voice and say, no, wait a minute. I don't think that that's right, and da-da-da. I may go get a second opinion. I may do a little bit more research. It's not what I've seen on the net. Let's hold off on that treatment until I research it a little more. People didn't used to have that capacity. They just trusted a doctor and a dentist that you know more. And so it was like a parent, which is where paternalism word came from. So paternalism and just wanting to decide everything for your patient and autonomy are in direct conflict. Quiz question or midterm or final, one of them. Paternalism and autonomy are usually in direct conflict, because one says we're going to make the decision for you. The other says we're going to respect you to make, be a part of your decision making and your treatment. So paternalism should never be applied to primarily benefit the professional at the expense of the patient. You need to have X and X and X and then guilt the patient into doing it when they may need it or they may not. So application. Historical role of the dental professional when patients lacked access to updated healthcare knowledge, it had to be paternalistic. We all expect our healthcare providers to make decisions based on our own best interest, and kind of no options were provided by them. So an historical benchmark was made back in the 1800s, because paternalism obviously has been around for centuries, by a political philosophy essay, which was written by a guy named Mills. And so he said way back in the 1800s that patients have a right to have a say in their own health care, clear back then, but had to fight having that. Educating patients of benefits and risks of treatment often create conflict between autonomy and beneficence. So you're trying to do what's good for them, and they're saying no. I'm trying to correct your, bring you up to optimal oral health, and you don't want to floss or brush when you're at home. Okay, so these are in direct conflict. So veracity. Veracity means truthfulness. Veracity is defined by being honest and telling the truth. So it's the basis of trust relationship between us and the patient. And the acknowledgement of veracity is in most code of ethics. It's definitely in the American Dental Hygiene Association and the American Dental Association, but it's a two-way street. Patients are also expected to be truthful, have veracity about their medical history, treatment expectations, and compliance. When you go through this stuff, you can do all the SRPs you want, but if they decide to go home and not do anything about it, then it's probably not going to have a great outcome. So application of veracity, we need to be truthful about the diagnosis, the benefits and disadvantages of each treatment option, the cost and longevity of each treatment option. So lying does not respect autonomy. If you're going to lie to them and say something is not as bad as it is because they're feeling bad about what they have or haven't done, that does not respect their ability. So some people are not happy to hear that for the last 40 years they have not been taking care of their teeth. Okay, and so now all of a sudden, in order to be not judged badly by you as the professional, they've got to take this little piece of string and floss all their teeth, and they're not real happy about that. So benevolent deception is something that's always been around, and it's withholding information because it would do more harm to the patient. It's called little white lies, and they rarely have to be used in the dental setting, but you need to know what benevolent deception. Benevolent means that you're trying to do something good, but it's deceiving someone. So we could say, oh, you're not doing that bad, and it's not that bad, and they've got loosened teeth and are about to lose their teeth. That's not doing them any good. So we're trying to respect their ability to make a decision. We're in the medical field. We've got to come out factually. We're not judging, we're giving you the facts. And that's it. So benevolent deception is not supported by most code of ethics, but they used this a lot. If you watch old shows, and especially Westerns or something from the older days, they would, there's a lot of times they will show this woman who is dying from childbirth, which seems like a lot of them did back in the day, and they're out on the prairie land someplace, and she's very ill and sick, and the doctor goes out and talks to the husband, and the husband says, is she going to be okay? And the doctor says, no, she's going to die, but we're not going to tell her because we don't want to upset her, so let's don't tell her. And they did that all the time. Would go back into the patient and say, you're going to be fine, you're going to be fine. because they didn't want to upset them. So that's benevolent deception instead of just, and we don't do a lot of that anymore. People are pretty factual. Values and concepts informed dissent. It's based on patient exercising their autonomy, informed dissent, consent, and their own treatment decision making. So it has both legal and ethical implications in medicine and dentistry. So it's two-pronged, and they will ask you, they talk about this informed consent being two-pronged. So I would make a note of this. It's two-pronged because one side requires a professional to provide relevant facts about what their treatment is or the decision making. And the second one allows the patient to make decisions, their own decisions about that, but it's based on the facts that you give them. So you have to give them factual things and let them make their own decisions. And so they can't make a decision unless you give them the facts, the right facts. So it's not respecting them if you don't give them the right facts. So that's why it's two-pronged. So the patient must be able to comprehend the treatment. That goes along with capacity, the capacity to understand. If they don't really understand, or they are on a different language, and they're not really comprehending what you're saying, then that isn't informed consent. Okay, that's unethical. So they need to be able to understand it. A patient has the right to informed consent and informed refusal. Informed consent, you explain what the treatment is. You explain what you're hoping to gain. You explain if they have the treatment, what you're hoping for the outcome to be, and you're explaining what may happen if they don't have it. All right, then they can make an informed decision. And then they can, if they have to write it down or on a piece of paper in some offices and sign, that's their informed consent. And they also have the right to informed refusal. Some patients will say, I don't want any bite wings. And it's this 2 years in a row they haven't had bite wings. And the dentist office can get into legal issues if they don't have take X amount of bite wings. Because they get in trouble with the insurance companies. The insurance companies saying, like maybe you're going to be nice. The patient doesn't have insurance, or maybe it doesn't matter the money. They just don't like the fact of being the radiation, and so they refuse. Well, the first time, if you don't see anything else wrong with it, then you can say okay. Then the second year, if they don't want to have an X-ray, your dentist has the right to refuse to treat them, because if they don't have it and then they come back the next year and then all of a sudden they need 3 crowns and send that into the insurance company wants to know why the heck you let it get that bad. Why do they have to pay so much money for crowns? When you could have put 3 simple little fillings in there, but maybe you couldn't see them because they were inapproximal, or they had to be seen on an X-ray, which the patient refused to do. So your costing, it's an issue. So your dentist has the right to say, I can't, normally, if you're not going to have X-rays, then you're going to need to go to someone else, because I don't want to take liability for what possibly is going to happen or what may happen. And that's, of course, patient dependent on what their kind of case is. So this applies to caregivers of children and those with diminished mental abilities. They have to be able, the caregiver, whoever's signing for the kids or the special needs, needs to be able to understand it and sign. Use of a translator would be mandatory. Providing informed consent with a language barrier is not possible. They cannot, language barrier, when they don't understand, they are diametrically opposed to each other. You can't have informed consent. So having a patient sign something when they don't fully understand it is not only unethical, it's illegal. So the only exception is if the patient's life is in danger and an immediate procedure is required to save that life. But in the dental office, that's not really going to be the case. That's more in the medical field. Capacity is the ability for the person to understand his or her own healthcare and treatment options and to make their own decisions. Capacity could be, another word is competent. Are they competent enough to understand? And this is a prerequisite, of course, for them to make an informed decision. So it implies the ability to understand, appreciate, and reason, be able to reason through the treatment possibilities. It relates to autonomy and informed consent, because you want them, if they can understand, then you're letting them decide yes or no to the treatment or bite wings. And if they agree to it, then they can have an informed consent if you've told them the benefits and the risks of doing something or not doing something. So the elements: understanding, appreciating, reasoning, expression of their wishes, and arriving at some kind of decision. So confidentiality. This relates to respect for persons and involves the patient exercising his or her autonomy in providing you the information. So the information to the professional. Confidentiality is evident in all codes of ethics that are out there. So it includes the right to privacy. This is medical and dental history, exams, discussion of treatment of options and their choices, and all their records pertaining to the dental and dental hygiene care. So it extends to the way the information is gathered, how it's stored, and communicated to with other healthcare professionals. So this means that when we have their information, they're trusting that we have encryption on our computers, and that if we are sending information about them to a referring doctor or whatever, that we have taken precautions as much as we can across the internet or the mail. So health information can be shared with the patient's permission. So the patient has to agree to that. And it has to be written, actually, agreement. And discussion of the patient information is not to be shared with spouses, family, or friends. If you do so, you go home at the end of the day and you tell your spouse information about, or your family or friends at a party about, Joe Schmo who had all these problems, you are in violation of confidentiality. Okay, and people really what they're thinking, instead of how funny your story may be funny but while they're laughing, they're thinking, I will never go to your office because what if you start laughing with some other group about stuff about me? So you don't create any friends for the short amount of laughter that a story may gain. And people know each other. People in smaller areas, the world is a small place. They may be able to figure out who you would be talking with if it's a bunch of people that all go, they're friends that all go to the same dentist. Not cool. So the patient's right to confidentiality often must be balanced against the rights of other individuals. So conflicts. I mean, can you always have confidentiality? No, you really can't, even though we totally believe in that. Let's say what the conflict would be is, let's say that someone has a communicable disease. Ebola was one. Okay, so when you have a disease like that, and now we're going through COVID, let's say that we found out somehow at a dental office, I don't know how at a dental office, but let's say that we found out, or that the medical community, when they first did this is what they're accusing China of right now, that they knew that there was this communicable disease and they said nothing. Okay, that's what the allegation is. So if we do that to protect their confidentiality, then pretty soon the whole world would, I mean, one by one, you'd die off of everything or something. So in the case of communicable diseases, we have to breach that confidentiality if it's a global issue. A communicable disease, the health department must know, and we must report to the health department of these kinds of situations, so not to annihilate everyone. There are legal requirements when we report these diseases, and they have definite effect on the public's health. Fidelity. Fidelity is the belief that it is right to keep promises, fulfill commitments. It's being loyal to someone, and the healthcare providers have a duty to fulfill all implied or expressed promises that are made to the patient. You got to be careful not to promise things that you can't keep. You can't say, even though we've talked about it like that, you can never say to a patient that, let me give you something that's going to take away all your pain, because then you've made kind of a promise that they're not going to have pain. And let's say that they're the type of person that the anesthetic did not hold on, okay, very well. And so they're saying, I felt complete pain. You promised that I wouldn't. I mean, it actually, if someone wanted to take it that far, they could actually have a lawsuit. Okay, you promised them something that didn't happen. So don't put yourself in that position. I always say, we're going to give you something that will help you feel more comfortable. They'll say, well, I feel everything. And we'll say, our hope is that you won't. Most people don't. You can say those types of things. You cannot say to them, oh, absolutely. You're painting yourself in a pretty dark corner. Okay, so we cannot abandon the patient prior to treatment completion, and we need to keep confidentiality unless it's a global or a communicable disease. So how do we apply these principles and values? Prima facie duties. Let's go back to that. That's the first, at first glance. They're done first. Prima facie means at first glance, it's like always do the act that is in accord with the stronger prima facie duty. Okay, so always do the act that has the greatest rightness over prima facie wrongness. Case in point, child abuse. Okay, when a child abuse is suspected, the stronger duty is to protect the child. At first glance, your stronger duty needs to be toward the child and not the right of the parent. All right. So someone keeps coming in your office and you're suspecting this, your stronger duty is toward that child and not to the parent. But also, as we discussed earlier in another video, you need to be careful how you're doing that, how you go about it. So applying the principles and values, there's 5 principles. It's universality, complementarity, ethics, community, and responsibility. The standards would be autonomy, confidentiality, trust, non-maleficence, beneficence, justice, and veracity. The 5 principles. Universality, what does that mean? It's kind of universal. You can think of it that way. What it means is if 2 or more people consider the same action or trait in the same situation, the same conclusions would be drawn. What that means is, let's say that you posed a question for all the hygienists across America, and you said, your question was, what do you do when you're in the middle of a prophy and you drop an instrument on the floor? Can you pick that up and alcohol it off and reuse it? There isn't 2 or tons of people would, under the same circumstance, would draw the same conclusion that no, you cannot do that. So that's universality, okay? Everybody would agree under the same circumstance that the same conclusion would be drawn. Complementarity is when this has to do with cultures. Um, you want to consider, most of the time, or religions, considering the values of others before making decisions that affect their body. Okay, it also has a little aspect of justice in there. So example would be differing ethnic beliefs. Complementarity is that someone comes in with a burqa amongst an office where there are no burqas, or people haven't seen them, and you want to do an extraoral exam, and so you want them to take their burqa off. Okay, so that is not ethical. You try to do the best you can around that situation, but we need to use the principle of complementarity, that we're going to consider their values and beliefs before we just make a decision that affects their body. So ethics. Ethics is, of course, the philosophy of morality, right and wrong. Community is our concern for the bond between individuals, society, and globally. Responsibility is for knowing and applying ethics, plus the consequences of our actions or failure to act. If we fail to act in something, we have breached responsibility. Something we know is right and we just kind of walk away from it, or wrong, then we've breached responsibility. This is in your book. You'll see that, and I like it shown this way because I think it's easier to memorize, and you will have to know these. The ADHA code and the ADA code. We believe that there's 7. They believe in the same first 5. You can see that these are autonomy, beneficence, non-maleficence, justice, and veracity. But the Hygienist Association, we believe that our principles, we add confidentiality and social trust, and they do not. They do believe in confidentiality and social trust. They do not have those two listed as just as a principle. So I think on the midterm, it's going to have you list the ADHA codes and then what the ADA code is. And so it's easy to memorize the first 5, and the hygienists have 2 more. So then you can this is just summary of what we all already talked about. That was a long one.